The head tilt maneuver moves the neck and is thus contraindicated in a patient who might have a cervical spine injury. To do the head tilt chin lift, tilt the patient's head back by pushing down on the forehead, and then place the tips of your index and middle fingers under the chin and pull the mandible up. This lifts the tongue away from the posterior pharynx and improves airway patency. The jaw thrust maneuver does not cause much motion to the neck and thus is preferred over the head tilt chin lift maneuver if there's a possible cervical spine injury. Stand at the head of the stretcher and place your palms on the patient's temples and your fingers under the mandible. Next, lift the mandible upward with your fingers. This maneuver lifts the tongue along with the mandible, thus relieving upper airway obstruction.